Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace. And today we are joined by Rhett Stover, the president of Proactive MD, and Matt Farnum, SVP and head of strategic markets. Guys, thanks for being on here. I know both of you are relatively new to the Proactive MD family. So do you mind kicking off the show by first talking about your roles within the organization?
Thanks again for having us. In my role as president, I really see it as my chief obligation to ensure that we're doing two things. One is that we're relentlessly focused and delivering and executing on our patient promise. And then two, ensuring that I'm serving alongside our executive team and functioning in the best, most collaborative and performance-oriented way to help drive the growth of our business, the impact of our business across patient populations that we're serving, and then that we're routinely just taking and pursuing an innovative approach to the market, consistently and constantly asking ourselves, what can we do better? How can we do more of that more often? And then again, making sure that the spirit of how we really confront and contemplate those questions is very focused and centered on our patient promise.
Perfect. And Matt, tell us a little bit about your role.
Yeah, from my standpoint, recently joining Proactive MD, just really fired up to be part of a innovative advanced primary care organization, working with forward-thinking employers, health plans, other solution partners to really enhance the patient experience and really partner with our in-health strategy with our clients to make world-class healthcare accessible for everyone.
So tell us a little bit more on how exactly Proactive MD is introducing market-specific solutions to accelerate growth with collaborative health plans.
As a care delivery partner who really understands risk, we collaboratively partner with a variety of health plans to support the unique needs of their members and their patient populations. Our partnerships are comprehensive and integrates the advanced primary care model that Proactive MD brings to the table to enhance cost efficiencies and deliver high quality outcomes and really an unmatched patient experience that's been validated every step of the way.
And can you share with the audience what types of health plans benefit from working with Proactive MD?
Sure. It's a relatively new segment, but we're really targeting any national, regional, or provider-sponsored plan who's really looking to optimize the healthcare delivery and total cost of care model that we bring as a solution set to their members. Our model is designed to perform in a variety of lines of business, from self-insured to fully insured employers, even Medicare Advantage, and the individuals gaining their healthcare coverage from the exchanges in the marketplace.
I would just add, as you start to examine some of the dynamics taking place regionally and nationally across the marketplace, you've seen health plans experiment with integrating or acquiring primary care practices, trying to utilize a more provider-friendly approach to building a comprehensive healthcare solution. And I think some of those experiments have played out in the market and produced a result of X, Y, or Z. Some health plans are deciding, hey, we're going to try that too, but we're going to do it a little bit differently. And I think for those that are leaning into that conversation, we've been uniquely benefited in that Proactive MD typically rises to the top of their consideration set as they start to examine what an advanced primary care solution could look like within a health plan or health insurance, either product or environment. But as Matt said, it's not significantly mature space at this point. I would still describe it as exploratory, but based on the service that we provided in our kind of core business and the success that we've generated for clients in that regard, we're uniquely positioned and have benefited, fortunately, from establishing a position of early consideration for some of those activities.
And you've talked about innovation and some of the forward-thinking stuff. You mentioned individuals. Is this model designed for employers or individuals, or both?
I would say the core of our business has been organized around self-insured employers who are making the decision to introduce an advanced primary care model as part of their total health benefit strategy or total cost of care strategy. And so we've really built our reputation and fostered our impact to date around that vertical, if you will. It's just been more recent that as health plans have started to evaluate for their own purposes and causes, ways to integrate an advanced primary care solution into their environment, that we've benefited from being able to position ourselves as a resource in that way. And that opens up more accessibility, more collaboration, and more care to those populations. And that can be in an individual capacity through individual products that are sold on the marketplace, some of that oriented in a governmental way, and others not. Other could be in a fully insured individual product, commercial oriented way. So the good news is that the entry into the health plan category opens up a number of different opportunities for us to avail ourselves to patients in populations where those health plans are either concentrated or where they're trying to establish some product differentiation and use the Proactive MD solution as a way to do that.
Matt, can you help elaborate on or explain how Proactive MD is supporting organizations transitioning from fully insured to self-insured? And really, I want to talk about data transparency as well and how crucial that is. How do you use data to support these organizations making a huge adjustment?
Yeah, to address the first question, employers move into self-insured plans. The integration of the advanced primary care model that Rhett was speaking about earlier, just in very pragmatic terms, provides a safety net. We help these clients realize a faster ROI on their health plan dollars by offering a comprehensive care management platform that really drives at establishing predictable costs for that organization. Employers, other than the employment costs of employing their staff, healthcare takes up typically the second largest cost center for most employers. And so we support that crucial decision making by helping make that transition towards the self-insured plans as smooth and as financially viable as possible.
And I do think the data piece and transparency piece is important.
Yeah, we use data in a variety of ways. The topic I kind of want to zero in on is how we stratifying member populations to prospectively identify patients who would otherwise benefit from the preventative care and early interventions that our model can establish. We take a real coordinated approach through integrated primary care, and as really kind of that quarterback, that center of referral management and care coordination, that our clients are really achieving the performance that I laid out earlier. The data gives us a proactive approach to mitigate and anticipate risk and costs, and includes $0 claims in our plans for all members encountered, and managing those accumulators through their deductibles as well than the plan designs themselves.
So we've talked about using data to stratify, and I'm sure like every other innovative organization in our space, you're keeping your eye on two things: quality and cost. Can you talk about what you all specifically do to ensure that care is provided in the highest quality, but also in the most cost-effective way?
Yeah, that's really my role for the organization, is how we construct the contracts and incentivize the right quality and cost outcomes for the health plan partners that we have, our employer partners, our clients. Really, we enter into value-based contracts with these partners to provide the care for targeted specific patient populations. Those contracts themselves are very detailed. They define the scope and the performance benchmarks, the quality measures that have been proven in our industry to be correlated with high quality long-term outcomes for the patients. Proactive MD is motivated then economically in one way to deliver that efficient, high quality care through these contracts. And our philosophy really contrasts with the other models in the market, which are really fee-for-service driven, where providers that are fee-for-service based are paid transactionally and really incentivized around volume of services that they render, regardless of outcomes. And so with our model, by focusing on preventative care, early intervention, site-appropriate care, coordinated management, those sorts of things, Proactive MD can really improve patient health and wellness while also improving the efficiency of the total healthcare dollar.
And then can you elaborate as well on how Proactive MD delivers care for those members enrolled in Medicare Advantage?
Oh, sure. We are looking to partner with senior-focused health plans that have experience with underwriting a competitive product in geographies where we have good access points, scale, and we've stood up our care delivery model substantially. That becomes an attractive profile for these Medicare Advantage payers. And as we kind of move into that space, we're contracting under the risk-adjusted premium benchmarks. We focused on star ratings to maintain and improve the star ratings of those plans that we partner with. And we are integrating advanced document encoding procedures to otherwise be good stewards of our care coordination procedures and provide members with exceptional patient experience. It's really a high-touch model, and our members receive the care and attention that a member of their family would be proud to have them access and be seen by our doctors.
I love that statement. As we're rounding out the show, do you mind sharing with our audience any other differentiators that really set Proactive MD's model apart from other primary care models that are available today in the marketplace?
Sure. We have this model called Care Beyond Walls. And really what it amounts to being is that we were pioneers in how we leverage social workers as patient advocates in our space. We drive industry-leading patient engagement and come alongside the patients throughout their entire healthcare journey. We guide them to, again, high-quality, cost-efficient specialists and facilities that deliver great outcomes and optimize the employer's healthcare dollar as they're a meaningful part of the equation as we finance healthcare delivery in the country. The fast facts on that are, we have a 91 Net Promoter Score, which is multiple times better than our competitors in this space. And we're just really excited about the prospects for growing and taking on stewardship of these patient populations as we expand our portfolio into the health plan space.
So if anybody wants to get in touch and learn more about Proactive MD, where should we send them?
Yeah, I would send them to our website, www.proactive.md. There, they can research and see more about our model and our solutions. And we'd be more than happy to set up a discussion or share more details or even schedule a consultation for whoever is interested in learning more.
Well, Rhett, Matt, thank you very much for being on today's show. Thank you for being such a great partner of the Granite List. And thank you for bringing Care Beyond Walls across the country to employer groups that so desperately want to and need to care for their people. We're really proud of the work that you guys do. So thanks for joining us today. And thank you to our audience for tuning in to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.